Good day to each and everyone. I'm Shahani M. Darakag and I'm going to discuss one of the infectious diseases in cardiovascular. This is pericarditis. So before I'll start this discussion, let's define what is pericarditis. Pericarditis is an inflammation of the pericardium. The pericardium is a thin, toluid, fluid-filled sac that covers the outer space of the heart, and also it provides a lubrication for the heart, shields the heart from infection and malignancy. Diseases and health problems can cause an inflammation of this membrane. This condition is called pericarditis. The causes of pericarditis include viruses, bacteria, fungal infection, parasitic infection, trauma from surgery or another injury. So what are the symptoms of bacterial pericarditis? The symptom of bacterial pericarditis depends on the severity of your condition and any underlying health problems. So the most common symptoms is a sharp stabbing or chest pain, or also known as pleuritis. This pain often moves or radiates to other parts of the body, including the left shoulder and neck. So other symptoms that may occur with bacterial pericarditis include pain when you breathe, shortness of breath when lying down, a fever, a dry cough, fatigue, a general feeling of sickness or malaise, swelling, and lastly, splinting of the ribs by bending over and holding your chest while breathing. So what is the causes of bacterial pericarditis? This condition is occur when certain bacteria enter the pericardium and cause an infection. So the most common bacteria to cause pericarditis are Staphylococcus, Streptococcus, and Pneumococcus. The bacteria can enter the pericardium through your bloodstream from another infection in the body such as pneumonia, from an infection in other part of the heart, or through surgery, or when a catheter is inserted to drain fluid from the pericardium, and lastly, or as a result of trauma. People with a weak immune system are at increased risk of developing bacterial pericarditis because their body are less able to fight infection. So the health problems that may increase your risk of developing disorder include immune deficiency conditions such as HIV or AIDS, chronic diseases such as diabetes, alcohol abuse, vascular heart disease, and lastly, urine or excess uric acid in your blood. So how is bacterial pericarditis diagnosed? So your doctor will perform a physical examination to see if you have the symptoms of bacterial pericarditis. So they use a stethoscope to listen for sound in your chest. So if you have a bacterial pericarditis, they be able to detect pericardial rub, which is a sound that occurs when the layer of the infected pericardium rub together. So your doctor may also check to see if you have a sepsis, which is severe and potentially life-threatening infection that can spread throughout your body, or pericardial infusion or fluid build-up in your pericardium, or pleural infusion or fluid build-up in the area around your lungs, or lastly, if you have a pneumonia. So if you have any of this condition, your doctor will order an additional test to confirm diagnosis. So these tests include CT scan of your chest, an MRI scan of your chest, an X-ray of your chest, especially of the lungs, heart, large arteries, ribs, and diaphragm, and the echocardiogram, which is a test that uses sound waves to create a moving image of your heart, and lastly, an electrocardiogram to measure the electrical impulse of your heart gives off. So, if you have a pericarditis also, your doctor will need to determine if bacteria have caused it. So, your doctor may order a test to detect the presence of harmful bacteria. So, this test is including the blood cultures, a complete blood count, a culture of the pericardial fluid, and lastly, a gram stain of the pericardial fluid. So the treatment. The treatment for pericarditis depends on the cause and severity of your symptoms. So mild pericarditis may get better without treatment. So the medication to reduce the inflammation and swelling are often prescribed. Examples include pain relievers. Pericarditis pain can usually be treated with over-the-counter pain relievers such as aspirin or ibuprofen. And colchicine, this drug reduces inflammation in the body, or it is used to treat acute pericarditis or if your symptoms tend to come back. And you should not take this drug if you have liver or kidney diseases because your doctor will carefully check your health history before prescribing colchicine. And lastly, the corticosteroids. The corticosteroids are strong medication that fight inflammation, so your doctor may prescribe a corticosteroid such as prednisone, or if you have symptoms that can back better with other medication or if symptoms keep returning. So if you have a pericarditis that caused by bacterial infection, you'll be treated with antibiotics and drainage if necessary. That's all. Thank you for listening and watching.